It's my feel-good breakfast show.
A very good morning, welcome back. It is your Feel Good Breakfast Show. Expresso on SABC3. We've opened our lines to take your calls talking about diabetes. That number is 083-913-3728 and Dr. Darren Green is in the house. Just did my test. We'll reveal the results just now, but first let's take our first caller. Pauline, good morning. All right, we seem to have lost Pauline at the moment. But so my test results, as you can see, I got my finger pricked and deposited some blood onto that blue piece of plastic.
That's your blood?
That's my blood right there. And 5.6 was my number. What does that mean?
Yes. That means that's in millimoles of glucose, basically, in your blood, and that's your random glucose. In other words, you weren't fasting. Now, a random glucose more than 11 at any time is significant for us to diagnose you with diabetes, certainly, and do a few more detailed tests. A fasting glucose more than 7 is important.
Yes.
So that's what we recommend to most of our patients. You don't eat for 6 to 8 hours, and you have your fasting glucose checked in the morning. And if it's more than 7 on 2 occasions, we diagnose you with diabetes mellitus.
Yeah. Tell me this, though. With the fact that I know that my grandmother's diabetic, right? How much of a concern should that be to me? I've heard things like it skips a generation. So if your grandmother was, you most likely going to be, and then your grandkids after that. How much of a role do genes play?
Yes, the truth is type 1 diabetes has a much stronger, genetic link. So type 1 diabetes being the one where your body's autoimmune system attacks the beta cells in the pancreas and disables them from manufacturing insulin. Type 2 diabetes, there's a combination of risk factors that are genetic, but also heavily related to lifestyle. In other words, weight management and sedentary lifestyle and not exercising and being active are big triggers for type 2 diabetes specifically. But you can imagine that the risk from generation to generation is getting worse because of our lifestyles currently.
Wow, and it's something that we can all prevent.
Indeed.
As I said, we are taking your calls, 083-913-3728. So give us a call if you have any questions to ask relating to diabetes. So we're talking about being active, making the right kind of choices, and this is all to try and prevent our bodies from, of course, getting diabetes. But what are some of the real complications that can occur when we look at this thing?
We divide them up into the big blood vessels and the small ones, so micro and macrovascular complications. So the small blood vessels, you can imagine in the eyes, can give you problems with your eyesight, as a lot of diabetics develop. And then you have the big ones where you have poor wound healing, for example, on the distal limbs or the legs. You have what's called venous ulcers, so you'll have a little itchy bite or an insect bite.
Yes.
And it doesn't, you scratch it and it takes so long to heal, because you have a problem of having good blood supply, but also blood drainage from the lower limbs.
Wow.
And that leads to poor wound healing, etc. The biggest complications, the killers, 75% of diabetics die of a cardiovascular risk disease. So that implies things like myocardial infarction, heart attacks, and then obviously the other 20%, generally stroke specifically.
Wow.
So the blood vessels in the brain.
And this is all things that you can prevent when we're looking at just being healthy. In fact, look at this statistic. According to the South African Medical Research Council, 7 out of 10 South African women weigh more than what is considered healthy, while 3 out of 10 men are considered overweight or obese. Even scarier than that, 1 in 4 girls and 1 in 5 boys under the age of 14 are overweight and obese. So much more the importance for us to live healthier lifestyles. Take a look at this.